This video is reviewing the bone and muscle anatomy of the elbow. It's important to note at this point that there's a lot of overlap between the elbow and the wrist. So there are several muscles that are listed in your book kind of with the elbow section that we're actually going to skip and talk about with the wrist and the hand just because they fit there a little bit better. So we're going to focus mostly on the muscles that actually cause action at the elbow instead of being a synergist, and then we'll lump those muscles that act primarily on the wrist in with the wrist and the hand and kind of the forearm. So to begin with, we're going to look at the humerus. The important thing when we're looking at the humerus to begin with is to decide whether we're looking at the medial or talking about the medial or the lateral side. So the medial side is always the side that has the head of the humerus. So that's where obviously our glenohumeral joint is, where the humerus articulates with the glenoid and the scapula. So that's always going to be the medial side. So we have the medial side and the lateral side. You can also identify the lateral side by this kind of bulbous region that we see here. So once we have identified the medial and the lateral side, we have a medial condyle and a lateral condyle. So the medial condyle is this region right in here, and the lateral condyle is kind of the lateral aspect of this region and in through here. Okay, so again, looking at our anterior view, we have our medial condyle and our lateral condyle. Now the large kind of bumps that are just below those condyles are called the epicondyles. So here we have our medial epicondyle, and here we have a lateral epicondyle. Above the condyles, we have what we call a supracondylar ridge. So just like we saw with the crest that were coming down from the tubercles in the more proximal area of the humerus, on the outside of the inferior portion, we have the ridge. So we have a lateral supracondylar ridge on the lateral side and a medial supracondylar ridge on the medial side. Same thing on the other side, we have the medial supracondylar ridge and the lateral supracondylar ridge. So the next thing we need to decide is if we're looking at the anterior or the posterior aspect of the humerus. So to do this, again, we would look up at the top and we would identify the greater tubercle and if we can see the lesser tubercle or not. And then when we look down at the more distal end, if we see essentially 3 little bumps, we know we're looking at an anterior view. And if we just see more of this W shape, we know we're looking at a posterior view. So starting with the posterior view, the first thing that we want to do is identify where our olecranon would sit. So we'll see the olecranon on the ulna here in a little bit, but we have this large gap right here. And this is called the olecranon fossa. So this is where that olecranon piece of the ulna will actually fit into the humerus and kind of make that hook. And we'll talk about that again more with the ulna. And then the portion that's kind of inferior to that, where the ulna actually articulates and wraps around, that is called the trochlea. So this area here where we have this W shape, that's called the trochlea. And then we also see the trochlea right here. This more lateral aspect, where we actually would articulate with the radius to some extent, this is called the capitulum. We also have 2 fossas anteriorly, so we have the olecranon fossa on the posterior side. On the anterior side, we have what we call the radial fossa. This is where the head of the radius would fit in. It's the more lateral of the 2 anterior fossas. And then we have the coronoid fossa, coronoid with an N, that sits more medially, and this is where the coronoid process on the ulna will fit into the humerus. So here on the left, we're looking at the ulna. It's important to remember that in the elbow joint, it's actually just the humerus and the ulna that are articulating. We could also call that the humero-ulnar joint. And the humerus and the radius really aren't articulating in that elbow joint. So they're kind of working together, but they're not what we would call a true articulation. So on the ulna, we have an anterior view and a lateral view. Looking from the front, we have this area that's on the anterior portion of the olecranon, and that's called the trochlear notch. So our olecranon is this posterior aspect where the ulna actually wraps around and grabs onto the humerus and fits into that olecranon fossa. Again, that's called the olecranon, where we fit in, and then the anterior portion of that, the concave surface of it, is called the trochlear notch. We also have another notch on the humerus where the radius would fit, on the ulna, excuse me, where the radius would fit, and it's just kind of a little bowl shape where our radius will fit into and rotate in our ulna, and we'll look at the radioulnar joint a little more specifically here in a minute. We also have on the anterior part of the ulna what we call the coronoid process. This is this pink area right here, and it's just this little hook that sits on the front anterior to the olecranon on the front of the ulna, and this again would fit into that coronoid process, or that coronoid fossa that we saw on the humerus. When we look just at the radius, we have a couple key regions of the radius. So we have the head, and then we have the neck, which is just the area just below the head, kind of where it gets a little bit thinner through from here to here. And then just below that, we have our radial tuberosity, or our radius tuberosity. Looking over at the ulna, we have that radial notch that we saw where the radius fits into the ulna. And then on this anterior portion, we have this kind of rough surface, and it's a little bit of a bump, and we call that the tuberosity of the ulna. And then just below that, we have this little ridge, and we call that the supinator crest. So we have the rough little bump, and we call that the tuberosity of the ulna, and just below that is the supinator crest. So when we look at the elbow joint, again, it's important to remember that we're just talking about the humerus and the ulna. The radius in the ulna creates the radioulnar joint, and then we really have the humeroradial joint. That's the slight articulation between the humerus and the radius. So the humerus, again, in the ulna is the elbow joint. The humerus creates our convex surface, and our ulna creates our concave surface. So this is a little bit different than a lot of the joints that we'll talk about, in that most of the time it's going to be the ulna that's moving on the humerus, so our concave surface will be moving around our stationary convex surface. So looking at each of those bones again, kind of running through our landmarks, so here on the posterior side we have the olecranon, and deep to that we have the olecranon fossa. The olecranon is attached to the ulna. Here again we have the ulna, and then we have the radius. Okay, and then our radius kind of fits into the ulna in that radial groove. And then we have the articulations between the humerus and the radius. So this area where the humerus, on the humerus, where the humerus articulates with the ulna is called the trochlea, and where the radius articulates with the humerus, on the more lateral side, we have the capitulum. So looking again, here we had that trochlear notch, and this would be our olecranon. We would have an olecranon fossa right about here that would fit in there. On the anterior side, we also have fossas for the humerus and the radius, or the ulna, sorry, and the radius to fit into. So we had this coronoid notch on the front of the ulna, and it fits into the coronoid fossa. And then we have our radial notch on the lateral side where the radial head would fit. So these two notches would be right about in here. So our coronoid process would be right here on the front of the ulna, and it would fit into the humerus just above, again in the coronoid fossa, and then the head of the radius would fit into the radial fossa on the more lateral side of the humerus. So our proximal radioulnar joint is one of the only pivot joints that we see in the body. So here we have the radius that fits nicely into this little notch, again on the side of the ulna, and then it's held in place by this ligament that we call the annular ligament. So the annular ligament runs the whole way around the radius, and it comes from the ulna, from this kind of articular cartilage that sits within the trochlear notch. So this is our trochlear notch, or kind of the underside of the olecranon, or the anterior side of the olecranon, and that cartilage is continuous with this annular ligament and its cartilage that wraps around the head of the radius and kind of holds the radius into that radial fossa. So because it's held in, the radius is held into the radial notch with that round ligament, the only motions that can happen here are rotations. So pronation and supination happen through rotation of the radial head in place within the radial notch. So it can't move medially, laterally, anterior, posterior. We just have all this rotation that happens within the notch. So it only has 1 degree of freedom. So So really quickly, we're going to run through the ligaments of the elbow as well, along with our anatomy stuff. So it's really important when we look at the ligaments that we determine if we're looking from the medial side or the lateral side, so we can determine if we are looking essentially at the ulna or the radius. So once we've determined that, and we can determine that by looking at where the radius is. So when we're in anatomical position, our radius would always be laterally. Okay, so if we're looking and the radius is closest to us, then we're looking at the lateral side. If the ulna is closest to us, then we're looking at the medial side. So looking from the medial side, again, we have that annular ligament that runs all the way around the head of the radius and holds it into the radial notch. And then we have our joint capsule, essentially. So it's kind of above that annular ligament, and this is what really connects the rest of the radius to the ulna. So it wraps around the capitulum, and then it's kind of continuous all the way across the top over the olecranon. So this really encompasses most of the posterior side of the joint. So it runs again around that olecranon process and then connects the olecranon to the humerus, and then kind of moves inferiorly and wraps around the radius, and we'll see it from a different angle here in a second. And then we have between the ulna and the humerus, we have our ulnar collateral ligament, and between the radius and the humerus, we have our radial collateral ligament. So looking again, over on the left-hand side of the screen, we are looking at the medial side. So again, we're identifying the ulna, and we would consider it from kind of anatomical position. So we're looking at a medial view of the elbow. So here's that annular ligament again that wraps around the head of the radius and holds it into the radial notch. And then we have this kind of three-stranded large ligament on the medial side, and it has fibers that run in three different directions. And this is the ulnar collateral ligament, or what we typically see called the UCL. So when we talk about throwing injuries to the UCL, this is the ligament that we're talking about. So the UCL is really large, and again, it has fibers that run in all three directions. So it has some fibers that run kind of on an angle, some that run almost straight back, and then some that run up and down. But they're all going from the medial epicondyle on the humerus to the olecranon on the ulna. So we have, again, these more anterior angled fibers that are attaching to the front of the trochlear notch in the olecranon. Then we have fibers that are running from those angled fibers back to the posterior aspect of the olecranon. And then we have some fibers that are running straight from the medial epicondyle down to the olecranon. So still looking at that medial view, we can also see the articular capsule that rotates around from the more lateral aspect of the humerus and wraps around to kind of the medial side of the ulna and inserts into the ulnar collateral ligament. And then we can also see the articular capsule, or the articular ligament, or the joint capsule, whatever we're going to call it, on the posterior side behind that ulnar collateral ligament. In between the radius and the ulna, we also have this interosseous membrane. We don't usually call it antibrachial. We just call it the interosseous membrane. Looking from a more lateral view. So over here, now this is a really important thing to note, we have a lateral ulnar collateral ligament. So on the medial side, we have the ulnar collateral ligament, and on the lateral side, we have the lateral ulnar collateral ligament. So this is going from the humerus, and then it kind of dives underneath and wraps around the annular ligament that again holds the radius in, dives underneath the radius and attaches to the ulna. Okay, so it's going around the accessory or the annular ligament and then attaching underneath the radius to the ulna. Also coming off of the annular ligament on the lateral side, we have the accessory collateral ligament, and it's just attaching the annular ligament down to the humerus right beside that lateral ulnar collateral ligament. And then we have a radial collateral ligament that is coming from the head of the radius out to the lateral supracondylar ridge on the humerus. And then again, we can see this articular capsule on the posterior side, just like we could see it posterior to our ulnar collateral ligament on the medial side. So now we're going to jump into the muscles, and again, remember that some of these muscles we're going to lump in with the wrist and the hand because that's where they produce most of their motion. So there are muscles that originate up by the elbow that we're going to put in our video with our wrist and our hand and just focus on the prime movers at the elbow for this video. So make sure that you go back and look at our good friends, the bicep and the tricep. We reviewed those in the shoulder video, so make sure you go back through those and touch up on those again. Remembering that the prime action of the bicep is elbow flexion and the prime action of the tricep is elbow extension. So the brachialis is one of the key elbow flexors and it lies right underneath our bicep. So this is a muscle that we don't really visualize a lot, and it really helps to add some bulk to the bicep. So the bicep likes it a lot. But again, it's one of our prime elbow flexors. It has a lot of mass compared to the bicep's length and is a strong elbow flexor. So the brachialis originates on the distal half of the anterior surface of the humerus. So if we took the bottom half of the humerus and this entire ridge on the front side, again, is where that originates, and it's deep to our bicep. It inserts onto the tuberosity of the ulna and the coronoid process, which was that ridge that sat right on the front of the ulna. It's innervated by the musculocutaneous nerve, and again, it's a strong elbow flexor. The brachioradialis is another elbow flexor that also helps with pronation and supination of the radioulnar joint. It originates on the lateral supracondylar ridge of the humerus, so that ridge that was just above the lateral condyle. And it inserts on the styloid process of the radius, so that's the kind of lateral ridge on the distal end of the radius. It's innervated by the radial nerve and causes elbow flexion and assists with radioulnar pronation and supination. The Anconeus is a triangular muscle, and it originates on the lateral epicondyle of the humerus, and then it runs medially and kind of inferiorly, and it attaches on kind of the length of the posterior side of the olecranon. So it originates on that lateral epicondyle of the humerus, kind of on the posterior aspect of that lateral epicondyle. It inserts on the posterior aspect of the olecranon process and the lateral edge of the ulnar shaft. It's innervated by the radial nerve and is a weak elbow extensor. So the Pronator Teres is the first of our muscles that is primarily responsible for pronation of the radioulnar joint. It originates from the medial epicondyle of the humerus, as well as the common flexor tendon that it would share with the bicep, and then the coronoid process of the ulna. That runs across the anterior surface of the ulna and inserts into the middle of the lateral surface of the radius. It's innervated by the median nerve, and its primary action is pronation of the forearm, and it assists with elbow flexion as well. So the Pronator Quadratus is the only muscle that doesn't have close proximation to the elbow, but we still discuss it here because it is a primary pronator of the forearm and of the radioulnar joint. So it originates on the medial and anterior surface of the distal aspect of the ulna, and it inserts into the lateral and anterior surface of the distal radius. So again, it's running from the ulna to the radius, so from medial to lateral. It is innervated by the median nerve, and it causes pronation of the forearm or the radioulnar joint. So the supinator is the prime muscle causing supination of the radioulnar joint. It originates from the radial collateral ligament and annular ligament, as well as the supinator crest on the ulna. So that was, again, kind of that little anterior portion just below the coronoid process on the ulna. It inserts onto the lateral surface of the proximal shaft of the radius. It is innervated by the radial nerve, and it causes supination of the radioulnar joint. Really quickly to recap, there are a lot of other muscles that originate really close to the elbow joint, but we're going to integrate those with the forearm and the wrist and the hand. So there's going to be a little bit of skipping around in your charts at this point, but all of those other muscles we'll catch next week with our wrist and our hand video. So again, there will be a quiz that will be posted, and that quiz will be due on Monday. So make sure that you go ahead and do that quiz, and there's a handout as well that follows the video. The lecture for Friday that goes with this video will be following tomorrow.